Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Bunionettes Causes and How to Treat Them. A bunionette is a prominence of the fifth metatarsal bone where it meets the bone of the little toe on the outside of the foot. Bunionettes can cause the little toe to turn inward. Bunionettes are similar to bunions, protrusions that occur on the inside of the foot below the big toe. /r/n/r/n In most cases, narrow footwear can exacerbate the problem, and pain relief is achieved by choosing footwear that is wider in the toe area. /r/n/r/n This article discusses bunionettes, what causes them, and how they are treated. /r/n/r/n Bunionettes are also called tailors' bunions. The name comes from the fact that tailors were known to have this condition because of the posture they kept while working. /r/n/r/n A bunionette may start as a painless bump that forms on the outside of the foot just below the fifth toe. Bunionettes affect the fifth metatarsal bone, which is one of the long bones of the foot. People with bunionettes often also have bunions. /r/n/r/n Over time, a bunionette may become swollen, red, and painful. A hard corn or callus may grow over the bump. The bump may grow and the little toe may be forced to turn inward. /r/n/r/n Bunionette pain tends to be worse when you wear shoes that rub on the irritated prominence. You probably won't have pain when you switch to shoes with a wide toe box, you go barefoot, or you wear sandals or flip-flops. /r/n/r/n Bunionettes can cause more significant problems if the irritation causes breaks in the skin. In these instances, an infection can occur and cause further problems. This is especially a concern if you have diabetes. /r/n/r/n There are both extrinsic and intrinsic causes for bunionettes. /r/n/r/n Like bunions, most bunionettes are caused by an inherited problem with the structure of the foot that is aggravated by poor choices of footwear. /r/n/r/n Specifically, wearing footwear that constricts the forefoot such as high heels or shoes with narrow, pointed toe boxes is the biggest risk factor for developing a bunion or bunionette. /r/n/r/n Therefore, bunionettes are much more common in women than in men, although cowboy boots can be to blame for both men and women. /r/n/r/n A self-check of your symptoms can often lead to an informal diagnosis. /r/n/r/n If you have ongoing pain or are at risk of an infection due to broken skin, especially if you have diabetes, it is good to seek a formal diagnosis from a healthcare provider. You can start with your primary care physician or visit a podiatrist or orthopedic specialist. /r/n/r/n The diagnosis can usually be made by performing a physical examination and reviewing a patient's history. Sometimes, an X-ray will be done to look for the extent of damage. /r/n/r/n Although treatment won't get rid of a bunionette, it will help clear up symptoms. Most of the time, bunionettes can be managed with conservative treatment. Sometimes, however, it may be necessary to treat them surgically. /r/n/r/n Initial treatment of a bunionette should always focus on non-surgical options. These include /r/n/r/n When you look for the right footwear, make sure the ball of your foot fits well in the widest part of the shoe. This may mean you need to buy a larger size of shoe or a wide shoe. /r/n/r/n Over-the-counter bunion cushions can help, but they need to be used with shoes that have a wide enough toe area to allow for extra padding without further constricting your foot. /r/n/r/n When the bunionette is inflamed, you can apply a cold pack for 20 minutes at a time, several times per day. Be sure not to apply ice or a frozen pack directly to your skin. A nonsteroidal anti-inflammatory medication, NSAID, such as Advil, ibuprofen, or Aleve, naproxen, can help reduce swelling and relieve pain. /r/n/r/n. If you continue to wear footwear that is too tight in the toe box, your bunionette may eventually cause longer-term complications such as severe pain, infection, and difficulty walking. It can even lead to permanent deformity in the foot. /r/n/r/n. In the few patients who have persistent symptoms despite these treatments, surgical correction of a bunionette is an option. Surgery is performed to realign the bone so that it does not point outward. /r/n/r/n. This is usually performed as an outpatient procedure, but it can have a long recovery period. /r/n/r/n. Bunionettes are bony protrusions that appear at the base of the little toe. They are often caused by ill-fitting footwear and can eventually lead to more serious problems such as infection, trouble walking, and permanent deformity of the foot. /r/n/r/n. Bunionettes don't go away, but they don't have to be painful. Choosing footwear with a wide toe box can help relieve symptoms. You can also try putting padding on the bunionette or applying ice to reduce swelling. In rare cases, surgery may be necessary. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.